Okay, so now we're going to talk a little bit about the dermal filler. So this is an injection that we do here at Sparkle. And Bruno, can you tell us a little bit about that? And what, I guess we'll start with what can we treat with dermal filler? Where can we put it?
So
what does it do?
Before we talk about what we treat, I'd like to mention something about anything that's injected. This comes more into the informed consent part. So anytime we use a needle on the skin, it doesn't matter if it's micro needling, which is barely scratching the skin. Anytime the skin is broken, there's always chances of, I call them the big five, which is swelling, bleeding, redness, bruising, and infection. That being said, we can treat any of those complications. Mm-hmm. It's just good to know that it's most likely going to happen, and if it happens, it's not for long.
Right, and there's things that we can do before and after treatments to minimize those risks.
Correct.
Right?
Yeah.
Right, and what are some things we need to be mindful of when doing, injections or anything we're going to be breaking the skin?
The big thing is staying very hydrated before mm-hmm. treatment. Avoiding any products or supplements that can increase mm-hmm. your chance of bruising, bleeding, swelling, especially medications like Advil or naproxen, any NSAIDs, avoiding alcohol. Yeah, it's unfortunate, but yeah, avoiding alcohol.
Just for a couple days.
Yeah, at least 2 days before treatment is optimal. Is it going to really change the effect of the treatment? Not really, but it can affect the experience of the post-treatment phase.
And you could bruise easier.
Mm-hmm.
You don't want to look like, you just got in a bar fight.
Right. For dermal fillers, the main thing that we want to address with dermal filler is the volume loss that happens with age. With that volume loss comes some wrinkles, some deep lines, and a loss of that youthful fullness of the face. So we can address that with dermal filler as it takes up space where we inject.
So we can think of dermal filler as filling and adding volume.
Correct. Which areas can we do with dermal filler? The go-to is cheeks. We can do temples. Lips is probably one of the most popular out there. There's jawline, mandibular angle, chin, nasolabial fold.
Jawline would be to give more definition.
More definition, yeah, more definition. But it all has to do with the lovely ratio of the face, right, when you evaluate.
It's about creating symmetry, right?
Symmetry and bringing back a youthful look, depending on where the majority of the volume loss happened.
Right, so kind of replacing what's been lost. And could you address the misconception that everybody who gets fillers looks full and overfilled? Right. Again, you have that natural look.
Yeah. So usually the people that you notice that had filler, if you notice it, you had too much.
Yeah.
If it looks refreshed, if they look less tired, if they have more of a youthful look, then it was tastefully done.
Right, because you don't notice someone who's had filler if it's been done well.
Correct.
Right. Yeah.
That's a goal.
That's the goal. Mm-hmm.
What to expect during the procedure for dermal filler? It depends on the area and how much is done during the treatment. Mm-hmm. It can last between a half hour to an hour. We can use topical numbing to make it comfortable, although most of the areas will not be painful and is very well tolerated. But yeah, about a half hour to an hour, depending on how many areas we target.
Targeting? Okay.
Mm-hmm. After the treatment, again, you should expect some swelling. Could be usually there's a bit of redness where the needle did penetrate the skin, or even some bruising. That is always a possibility that it happens. It should resolve within a few days. Putting ice on it after the treatment is a very good idea. No alcohol for at least 24 hours. Again, no NSAIDs like Advil, Toradol, naproxen. The treatment should last, depending on the area and how active that area is, should last between 6 to 18 months. Some people it lasts longer, some people it lasts less, depending on their metabolism. But a follow-up is recommended after treatment at the 2 week to a month mark, just to make sure that you're happy.
Wonderful. Well, that pretty well covers it. If you have any other questions, feel free to reach out.